So officially, yeah, let us kick off our dialogue for this evening. And the first one on the agenda is naturally our welcoming speech from Didi Ling Huat, our past president of Theravada Buddhist Council Malaysia. So with this, I pass over to Didi Ling Huat to lead us in this beginning part of our dialogue. Didi Ling Huat, over to you.
Thank you, Sister Mian. My respects to venerable members of the Mahasangha, Suki Hotu brothers and sisters in the Dhamma. I'm Brother Ling Huat, representing Theravada Buddhist Council of Malaysia. Welcome to this very special program that we have tonight called A Dialogue with Buddhist Medical Practitioners, Mental Health Impact of COVID-19, a year after and preparing for moving forward. It is perhaps very true that science has made society very modern and prosperous. We have technology at our disposal. It brings a lot of convenience and happiness to us. But this is useless if our minds are in distress. Our physical well-being rely deeply on our psychological well-being. The Buddha himself took the path of science, investigating, formulating hypotheses before his enlightenment. Lucky for us, the Buddha was a good doctor. He did not leave things at diagnosis level. He went forward to find a solution to end our sufferings. He gave us the perfect medication, a cure from suffering. His cure is perpetual. Today, we are very proud to have with us Buddhist leaders who are experts in the field of science, who will also not stop at diagnosis level too. Knowing COVID-19 as very contagious, our movements were restricted to prevent the spread of this disease. This has gone over for 1 year period and has brought distress and psychological impact on us, particularly the school children. The parents who have lost their jobs were worried on how to place the next plate of rice on the table. Such were the predicament faced, and has brought us great distress. These issues, I hope, our professionals on the panel tonight will address them. I'm personally looking forward for this very interesting evening. So before we begin, let me invite you to join me in paying homage and taking refuge in the Buddha, Dhamma, and Sangha, and also in observing the 5 precepts. So let's compose ourselves and say sadhu 3 times. Sadhu, sadhu, sadhu. Namo tassa bhagavato arahato samma sambuddhassa. Namo tassa bhagavato arahato samma sambuddhassa. Namo tassa bhagavato arahato samma sambuddhassa. Buddhang saranang gacchami, Dhammang saranang gacchami, Sanghang saranang gacchami. Dutiyampi Buddhang saranang gacchami, Dutiyampi Dhammang saranang gacchami, Dutiyampi Sanghang saranang gacchami, Tatiyampi Buddhang saranang gacchami, Tatiyampi Dhammang saranang gacchami, Tatiyampi Sanghang saranang gacchami, Panatipata Veramani Sikkhapadang Samadhiyami. Adinadana Veramani Sikkhapadang Samadhiyami. Kamesu Michachara Veramani Sikkhapadang Samadhiyami. Musavada Veramani Sikkhapadang Samadhiyami. Surameraya Majja Pamadatana Veramani Sikkhapadang Samadhiyami. Sadhu, sadhu, sadhu. Now to begin the program, let me introduce to you the moderator for tonight's dialogue. Sister Mian, clinical psychologist, works with individual, family, workplace, and community for more than 25 years, providing psychotherapy, psychological assessment, coaching, training, lecturing, supervision, and since 1999, pioneered Employee Assistance Program, EAP, in Malaysia. Delivered programs for a wide range of organizations, including crisis response, mental health emergencies at workplace, and mindful and self-compassion. Workplace and mindful and self-compassion intervention for managing stress, burnout, and enhancing emotional resilience. Has professional membership in the Malaysian Society of Clinical Psychology and Employee Assistance Professional Association. Currently a board member of Asia Pacific Employee Assistance Roundtable and Vice President of Malaysia Association for Mindfulness Practice and Research. Her work has been featured by various local newspapers, magazines, TV, and radio. So I hand over the microphone to Sister Mian now.
Thank
Sadhu,
you.
sadhu, sadhu.
Thank you, Didi Leng Huat. Apologies, Sister Julie gave you the long biodata for you to introduce. Thank you for your introduction.
Thank you. Yeah.
Yeah, and to the rest of our audience this evening, I have a harder task, which I'm going to introduce our 4 special guests for this evening dialogue. Yeah, nevertheless, I'm going to struggle like Didi Leng Huat. I've actually printed out because, all our special guests this evening are very important in their contribution to the medical world, to the community. So therefore, this part is where I will actually introduce each of them to all of you before we begin the dialogue officially. Yeah. Before I go to our medical practitioner, let me mention first, or let me introduce first. Yeah, our special guest for tonight is Sister Tan Lee Bee. Yeah, Sister Tan Lee Bee, she's actually a sign language interpreter, a very seasoned person with our local radio and TV Malaysia RTM, and she is frequently sought after by the royal palace, by the government agencies to do actually sign language interpretation for all the official function. So we are really blessed today that Sister Libby is free and able to join us in this medical dialogue. So therefore, all our hearing impaired community and friends will be able to follow through this medical dialogue with Sisters Libby's present here to interpret for all of them. So this is a special thanks to Sister Libby. And just to let you all know, actually, Sister Libby is one of the instrumental person who have started Dharma for the deaf, back in Mahavihara Temple almost 22 years ago. So these are the part of the Buddhist work that Sister Libby has done, spreading Dharma, and a lot of us didn't know, including myself until recently. So we hope that we will actually add on our effort to reach out to our hearing impaired community with Sister Libby's leadership, leading in the interpretation and so on and so forth. Yeah, so let this be 2021, our medical dialogue by Theravada Buddhist Council, where it is sign language interpreted, and many more of our Dharma classes or even retreats. Hopefully that our hearing impaired community can join us. So that's our first special guest. So now, of course, we're going to make our three medical practitioner work hard tonight on our dialogue. Yeah. So let me have the privilege, to introduce them one by one. And it's really my honor this evening to be the moderator so that I can really get all your question, to our three medical expert, our three, not only medical expert, because they are also very active, extensive Buddhist worker. Once I read their background to you, you will know what I'm talking about. So the first one, our first speaker for tonight is Dato Dr. Suk Chyn. She is actually a senior consultant physician and rheumatologist, heading the rheumatology unit in Hospital Tuanku Jaafar, Seremban. She was the former head of the medical department and a state physician of Negeri Sembilan, and the past president of Malaysian Society of Rheumatology. Currently, Dr. Gan, she's a very busy person, involved in medical research, an examiner with the MRCP UK examination, teaching and training all categories of doctors, and naturally still focusing on clinical care of patients with special interest in patient advocacy, empowerment, and education. And Dr. Gan actually founded the Negeri Sembilan Arthritis Association, an NGO for people with arthritis in Negeri Sembilan since 2012. And naturally, they have done a lot of good work, public forum activities, so on and so forth. And Dr. Gan is actually the current president, of the Negeri Sembilan Arthritis Association. And Dr. Gan and her husband, Dr. Wu, actually founded our Seremban Sudama Buddhist Society since 2008. There you go. Our speakers are all very special, in their Buddhist work. So that's our Dato Dr. Suk Chyn. Second speaker for this tonight's dialogue is our Dr. Ong Tien Kwan. Dr. Ong was actually in University Hospital's primary care unit before he set up his own private general practice in Bandar Sungai Long back in 1996. And apart from his medical services to the community, Dr. Ong is very active in Buddhist work and meditation practice. He was the founding president of Sungai Long Buddhist Society and the Mahakaruna Compassionate Home. Dr. Ong has actually written a book called Meditation, Tool for Transformation, and he also authored several books on personal transformation and health. For example, the Book of Personal Transformation and Daily Mindfulness for Personal Transformation. And Dr. Ong is also involved at international level. He is one of the contributing authors of the 101 Great Ways to Improve Your Life, Volume 3, together with other contributing authors like the famous Byron Katie, Mark Victor Hansen, and many more. And currently, Dr. Ong is also the webmaster of the Transformation Work website. And naturally, Dr. Ong has been giving a lot of regular talks, conduct workshops, Dharma topics or self-improvement, personal transformation, mind science and spirituality. So that's our second speaker, Dr. Ong Tien Kwan. And our third speaker for tonight is Dr. Phang Cheng Kar. Dr. Phang is a consultant psychiatrist and mindfulness-based therapist at Sunway Medical Center currently. And he is well known in our Buddhist community as the developer of the Mindful Gym, a Malaysian mindfulness-based stress reduction and wellness program. And to date, he has conducted hundreds of workshops related to mindfulness. Besides being an avid speaker, he's also a prolific writer. Yeah, just like Dr. Ong too. Yeah, Dr. Phang has written quite a number of books, and I'm just going to mention a few here. Yeah, among some of the books are I'm Still Human, Understanding Depression with Kindness. And the other famous one is Now, Who Wants to Learn Mindful Gym? The 12 Mindful Tools for Stress Reduction and Wellness. He is currently the president of Malaysian Association of Mindfulness Practice and Research, and also the president of Kuala Lumpur Buddhist Mental Health Association. He volunteers at one of the free clinics at our Sentul Buddhist Temple for many years, and naturally also a regular speaker who gives talks and conduct workshops for many of our Buddhist organizations and NGO. There you go, our three esteemed speakers for tonight's dialogue. Yeah. So excited, isn't it, all of you? Yeah. So, and I hope more will actually join us on Zoom, but I believe many more have also joined us on our YouTube Live and Facebook Live. And, nowadays people are quite lazy to register, right, for a program, but they will actually tune in to the Facebook Live and YouTube Live. So I hope many people are watching, and naturally, we will have segment where you can actually ask questions to our three esteemed speakers later on. But part one of our dialogue tonight, what I'm going to do is that I'm going to invite each and every one of them to give all of us a short sharing. Yeah, each of them from their respective specialty and perspective. Yeah, and in a way we arrange this dialogue in a very unique way, because Dr. Gan, she's from the government hospital, so she'll be able to give us a glimpse of the impact of COVID-19 pandemic from the governmental area, government hospital, the frontliner, the patient, the family. Yeah, so she will share with us from that perspective. Dr. Ong, yeah, as a general practitioner in our community, yeah, so he handles a lot of individual and families, yeah, and naturally he's going to share more from the community perspective. And Dr. Phang, being the specialist, yeah, in the area of psychiatry, yeah, naturally I think he has seen and will be seeing a lot of challenging cases, and from the hospital perspective, coming to him specifically on mental health challenges. So Dr. Phang will share from the psychiatric area. So each of them will do that. Yeah. So we will actually like Dr. Gan to start off, and then followed by Dr. Ong, and then Dr. Phang. Yeah. So Dr. Gan, over to you. So I'm going to mute myself now, and it's over to you.
Sekiyotu to Dhamma brothers and sisters. Thank you, Sister Mian, for the kind introductions. I'm very excited too, and felt very privileged to be invited to come to share my little knowledge that I have on this interesting topic by TBCM. So, as we mentioned, the topic for sharing today is on mental health impact of COVID-19. A year has passed since Malaysia has been hit by COVID-19. And what are we going to, moving forward from here? As a clinician, I will probably just talk about on clinical aspect of COVID-19. So over last 1 year, I think many people has learned and get to know a lot about this virus. Yes, SARS-CoV-2. And the disease caused by this virus is called COVID-19. So when it started in January, February last year, there are so many misery, fear, anxiety when we hear about this. I think everybody have the same feeling, including us healthcare worker. What is this? Is this going to cause as so much harm like the SARS infections endemic in 2003? So now we know over a year we have learned this COVID-19, what is going to cause to us. And we know that this COVID-19 going to, when a person infected by COVID-19, it will be either has no symptom at all, or it may just have very mild symptoms. Okay, that we call stage 2 disease, but the symptoms they get is just simple cough, cold, may have loss of smell, loss of taste, headache, just like simple flu types of illness, body aching, a bit poor appetite, but they have no difficulty in breathing and they have no pneumonia. So when they get more severe, we call that symptomatic pneumonia, where the virus has traveled down to the lung. And when stage 4, it becomes more severe, where they require oxygen supplementation. And stage 5 are those critically ill patients where all of them, if possible, we admit them to ICU for care and may result in multi-organ involvement and death. So we know these are the 5 stages that a person infected with COVID-19 going to get. And we also know, okay, 80% of those infected with COVID-19 will be just stage 1 and 2. And only 20% will get stage 3, 4, and 5. So is there anything to worry? Most people will just get stage 1 and 2, but only 20%. I probably will be the lucky one, involve the 80%. Do you have this style of mindset? So as per today, okay, you see, globally, we have 130 million cases of COVID-19 infections, and nearly 3 million people has died of this disease. In Malaysia, today, this is the statistic that given today, we have increased new case by 1,638. And over 1 year, we nearly hit 350,000 cases. And remember, this 300 cases increment is only by year 2021. And our death rate, as you can see here, is our death rate is 0.37, nearly hit 0.4%, meaning 250 people who contacted the disease, one would pass away. And as for today, we have 1,631 cases. We expect about 6 of them will pass away from this illness. So I just want to, I have learned a lot actually over past year about this COVID-19. And I would like to call COVID-19 as my teacher, Ajahn COVID-19. What are the lessons as a Buddhist have we learned from this Ajahn COVID-19? All of us, lifestyle have changed. All agree with me, our lifestyle has changed. Our life, the world has transformed. Yeah, Dr. Ong will cover a little bit more on this. And all of us have a set of SOP to adhere to. Now, wherever you go, you have to check your temperature, you need to wear mask, you need to sanitize your hand. And this is something that we will never dream of, that the world will change that way. Yeah, before this, you probably only see doctor in the operation theater will wear mask. Out of that, when we do procedure, we wear mask. The purpose of we wearing mask during the operations or doing procedure is to prevent when we cough, when we sneeze, we pass the disease to the patients. And also technology has become so important. Internet, Wi-Fi, social media has become so important to us. And over this 1 whole year, we have learned Zoom, endless Zoom opportunity to learn Dharma. I think probably 3 to 4 times per day, per night in the week, and 3 to 4 times medical talk. Just for example, today morning, I have the Dharma sessions with Sale Susila on Abhidharma. In the afternoon, I have a medical conference meeting, and then tonight I have this meeting with all of you. So this is the new norm and new life. So do we want to carry on, continue this way? So I just want to know from the audience here, over this one whole year, we have known quite a lot about this COVID-19. Are you all still scared of COVID-19? Or you feel, nothing really much? I see people who got COVID-19, they are still okay. Or you are more scared to get some money, 10K, that's a lot of money. Or now government had asked all of us to go for vaccination, or you're more scared of vaccinations. Can you type yourself in the chat whether you are scared of 1, 2, or 3? I just want to have a look. Please respond by type yourself in the chat. Are you able to see the chat here? I'm actually unable to see the chat.
A lot of one, Dr. Gun. I'm seeing the chat now. A lot of
okay,
one.
you will help me to see. I can't see the chat actually. So a lot of one, eh?
Yeah, 1, 3, 1, 3.
Oh, so there are people
1, 3.
not 1 and
2
3.
is only one person so far. A lot of 1, 3, 1, 3, 1, 1, 1, 3, 1, 1, 3.
Okay, so there are still more people who are still scared of COVID-19, and there are some people scared of vaccine, and not so many people who scared of someone. Okay, thank you very much. So, if that is the case, is vaccination? No, we are actually promoting that everybody should get vaccinated. Is there, but is it a real need that all of us should get vaccinated? This is a year forward, isn't it? We want to cut down all the COVID infections and so on. As we know, more than 95% of COVID infections were recovered from it so we will all recover from COVID infections, more than 95% of us. Okay, and we also know that the vaccination does not guarantee us will not be infected with COVID-19 again. So we ask ourselves, are there any alternative besides vaccination? So this is the question I pose forward to you. So now I want you to know how important that we should actually get vaccinated. So if you look at this graph, COVID-19 in Malaysia cumulative cases from January 2020 to January 2021, we have accumulated 100,000 cases over 1 year. But in February and in March, every month we have increased by exponentially by 100,000 cases. You look at these cases increment, you will have a lot of fear in you. And remember, mind you that if you are using the UK models for Malaysia, every one that we pick up, there will be another 4 infections we didn't pick up. So this is actually very grossly underestimate, okay? And of course, with the rise of these infections, the deaths have actually increased. As we mentioned, it's about 1 in 2,500 cases, 3.7 per 1,000 cases. So every 250 people get the disease will lead to 1 death. And there's a condition called long COVID. Brothers and sisters, have you all heard about this long COVID? And sometimes people also call post-acute sequelae of SARS-CoV-2 infection. Or another name for it is chronic COVID syndrome or long-haul COVID. And in which The patients wouldn't die from COVID, but they will continue to feel fatigue, difficulty in breathing, and brain fog, meaning they just say the brain can't think as sharp as before. And they may have sleeping disorders that Dr. Phang will share with you a bit more after this. And some will have a persistent low-grade fever, GI symptoms, the loss of smell and loss of taste. Most of people will recover for it, but some will linger on for some times. And all this will lead to anxiety and depression. And symptoms has persist for months. And we still do not have data that this thing can last and persist for how long, as we only have the disease data for about a year. Okay, and the symptoms can range from very mild to incapacitating, and it can also cause permanent damage to some organs, especially the lung, you know. So somehow COVID infect the lung and the lung become very stiff. So remember, this not only get in people with severe COVID. Remember the stages of COVID, 1, 2, 3, 4, 5. So people with stage 2, mild symptoms, mild disease, and young people can also be affected. So the best is actually, if you do not have COVID, you will not have give the COVID opportunity, and you will not suffer from this disease. Okay, I think that's my sharing introductions for today, for the short introduction now. Pass over to you, Sister Mian.
Thank you, Dr. Gan, for your sharing. And I will move through all the speaker first, yeah, before we do the Q&A. So Dr. Ong, over to you now for your presentation.
Thank you, Sister Mian, for introducing me. That was a very generous introduction. My slides are with Brother John, I think. So if the slides are ready, then we will start. Brother John. Okay, I think we start with the second slide. Not this one.
Dr. Ong, would you have it on your laptop? I make you co-host so you can actually share directly too from your laptop if you have it.
Okay. Yeah, this is the one. All right. Can we go to slide number 2? Go up to slide number 2. Well, anyway, we can start with the slide that we have. It's not a problem. Let's start with the slide that we already have.
Hang on, I think there's a lagging in the, what do you call that? Yeah. One of the greatest stress of COVID-19 pandemic is having to do virtual meeting with multiple aspects to manage technically. Brother John, would you like Dr. Ong to present directly, and you can stop your sharing from your side, Brother John?
Yeah.
Yeah. So
no, it's okay because I have only 4 slides. Okay, then I will start the share screen. Okay, give me a minute or so. Yeah. Okay, right. I'm going to talk a little bit about the impact of this COVID-19 pandemic that I see at the community level. Of course, will not be possible for us to cover all the important issues that have arisen because of the COVID-19 pandemic. But there are a few things that I would like to highlight in tonight's discussion. The first one is the loss of livelihood. This is an area, various degrees. This is an obvious impact that all of us experience. The second is the impact of being isolated and separated from our loved ones and friends. And the third one is the unspoken or even sometimes unconscious grief that we have for the things that we have lost. And the fourth one, which is actually a major one, is the fear that is pervasive within the community because of this COVID-19 pandemic. So I will go straight to the first one, loss of livelihood. As we know, this loss of livelihood started in the mid-March of 2020 when the government implemented the movement control order in its various forms. And from the moment that was introduced, practically we can say that the entire economy of the country was brought to a standstill. And this one affects people at all levels. However, it disproportionately affects the poor more severely than the rich people. For example, people who were getting contractual jobs that are paid on a daily basis, they immediately lose their job. And with the loss of job, there is no income. And without income, it was a challenge to put food on the table for their family. Okay. And there were also others who may hold on to their jobs, but salaries were cut, some up to 60, 70%. And even those who were allowed to operate and continue their businesses like our clinics, we see a drastic drop in patients because after all, no movement. What can the business do, right? And there were a lot of fears. Even if you open up, nobody wants to come, right? So, and even for this very poor, some of them may be fortunate enough to have some savings. But because the pandemic and the MCO dragged on for the entire year, very soon their savings were all dried up. It was a real challenge for them, right? And some people resorted to just buying medicine over the counter, either from the pharmacy or from the clinics, just to save on paying for consultations. Kids in these families were not having any computer access because they may not have computers or internet lines, and being locked up at home and not being able to go to school and not being able to go out, there were great impacts on these kids as well, which I will touch on a little bit later. On the other hand, the rich has more resources at their disposal. No, I know at least one family who has stayed at home throughout the entire year, just getting food through online. And in fact, some of these rich families, they can afford to get doctors to do house call because they would rather have the doctors come to their house than go out to the clinic. That was the amount of fear that we have, particularly during the early stages of the pandemic, right? But despite this, it was very, very heartening to see that there were a lot of compassionate people who mobilized themselves either at the individual level or in groups or through NGOs, who mobilized, organized, and raised funds from willing contributors to buy food and essential items, pack them, and delivered them to those families in need, right? And they were doing this without regards to race or religion. So it was really a very good thing to see. during these difficult times. With regards to the second one, the impact of isolations and separation from loved ones and friends, the greatest impact on elderly who live alone, and before the pandemic, they get visits from their children or friends on a daily basis or every few days, so that they will be checking on them to see that they're healthy, they're getting their food, and they're not totally alone. But when the MCO was implemented, this was not possible. So it became a lot of stress for both the elderly as well as the children who looked after them, and even for their friends, because movement was not possible. And a lot of lonely time at home, these elderly people start to ruminate, and with proliferations of thoughts, there were worries and anxieties and depressions. So during this time, we do see quite a number of people who were very anxious and very depressed. And even the spouses, for some people, being locked up in their home over a prolonged period of time, they were able to utilize the time usually to increase bonding in the families. And some were able to use the ample times that they had to learn new skills, new recipes, looking for new opportunities, learning about social media like us. But there were others who, because of prolonged exposures, prolonged time at confined space, started to argue, have more marital challenges, and this is worsened when the finance is tight. So it may even lead to mental, emotional, and physical abuses. As for the kids, because there was no opportunity to go to schools, and some of these children have no internet access, no friends to talk to, it was a stress to them as well. So overall, there was a greater sense of helplessness, boredom, and loneliness for everyone. Then there was this unspoken grief for the things that we have lost. Actually, Malaysia is one of the lucky few countries where our death rate is actually relatively low compared to others. However, we do lose patients to COVID-19. And this kind of loss was something we have never experienced before, because for the COVID-19 patient who is dying, there was no family contact. Families were barred from visiting. So it was a very lonely process. There was no personal touch. There was no opportunity to show their love. There was no chance for closure. And even when the patient has died, the burial was done simply and quickly with limited numbers of people. So all this grief may not be properly expressed, so the bereavement may not be properly expressed as well. So these are difficult times and very challenging times. Even for those of us who do not lose anyone to COVID-19, we have lost our freedom to move. We have lost our contact with our loved ones. We have lost our sense of safety. We feel more vulnerable now because of the COVID-19 pandemic. Lastly, this is a pervasive in the community. We can remember that at the beginning of the pandemic, there was widespread panic, so much so that sundry shops ran out of toilet rolls, tissue papers, daily essentials. Okay, we can understand the overreaction and panic during the early stages of the pandemic, because at the time we knew very little about how the viruses spread. This, we overreact in that way. But over time, we should virus spread in a very limited way, airborne, through the aerosols. And in fact, in the initial stage when newspaper was publicizing the presence of the COVID virus on surface of the tables and doorknobs and how long they remain on those surfaces, I think sometimes we also need wisdom in sharing the information, even if the information is correct and accurate, because that aggravated the panic, that aggravated the fear. Today, we know that most of these infections occurs airborne, hardly any through formats. Okay, so we need, I think, going forward, we need to make sure that our informations are up to date so that we do not base our behavior on old misleading informations. And as Dr. Dan said, you know, the social media impact is tremendous. And because it is so fast, fake news travel very, very fast. Misinformation even faster. There was a point of time where in my own practice, we diagnosed a patient with COVID-19. We sent the patient to the hospital for detection, and when the result came positive, the patient was promptly sent to the hospital. But very soon after that, my nephew in UK learned that I have a patient with COVID-19. And the message he got seems to imply that my staff and myself are also COVID-19. So you can imagine the kind of panic in the community over this news. So one thing I have learned in this pandemic is that even when you want to share information, please make sure you check your facts first. Very, very important, right? We don't want to contribute to more fear, more panic. Useful information. In fact, the best thing to share information, whether it is online or whether it is verbally, is still to follow the Buddha's advice on right speech and how to communicate properly. The Buddha advised that first, before we say anything, check, is it true, right? Now, even if it is true, the next thing we should consider is it beneficial? And even if it is beneficial, then the third thing we need to consider is it appropriate to share? Is this the right person to share with? Is it the right time? Is this the right situation or condition to share? And when we share, are we sharing it with the intention to be useful, to help, or otherwise? So when we use social media, I think we should all keep this in mind. Many of us have this attitude that when we share in social media, we want to be the first to break the news. That is not going to be very healthy. The most important thing, I think, before you break the news, first, make sure you don't break the precepts. So check to see whether it is truthful, it is beneficial, and whether it is appropriate. Okay. So I think going forward, now we should on social media. And I think the other things that we need to look forward to will eventually be the vaccination, which I think is going to be discussed later. And eventually, we will require a lot of financial support as well as psychological support for our people, our society. So I think with that, I will stop my sharing and so that we can move on to Dr. Phang. Thank you.
Thank you, Dr. Ong, and I'll pass over to Dr. Phang to continue the flow.
Thank you very much, Mian, for the nice introduction earlier. Very good evening to all brothers and sisters in the Dharma. Yeah, so my sharing is mental health impact of COVID-19, a private psychiatrist experience. Before I share more, I would like to dedicate this sharing to my mom. That's my mom. She's 70 plus. Wishing her long life and good health. I'll be sharing from three aspects. One is on personal experience. Then is the experience at the hospital level, and then the experience at the clinic level. Because they are all interrelated. I'm working in a clinic, which is in hospital, but I sort of categorize the sharing in just three interrelated parts. Yeah, on a personal level, I'm grateful that somehow the pandemic didn't affect me negatively much. I'm very grateful that in a way my life was simpler. My life was just between the hospital and home and hospital. And I'm very grateful that at home I have my mom to cook for me. Yeah. I'm also very grateful that I have the triple gem, the Buddha, Dharma, and Sangha to guide me to overcome the changes and challenges. I also thank the supportive karma. Somehow I wasn't affected too much. Of course, it was stressful, but somehow it wasn't affected too much. I still can maintain my right livelihood in a hospital setting. I can still serve the community in the clinic. In fact, I quite like the pandemic sense that because less activities. Before that, I was running around and quite prone to burnout. So during the pandemic time, it's just, of course, work in the hospital, then come back and rest. Life was much simpler, and I had more time for meditation, more time for reflection, more time to listen to Dharma talk, read the sutta, do some writing. Yeah. So it wasn't too bad at the personal level. So thanks to the triple gem, thanks to the supportive karma, and grateful with the causes and conditions that somehow it didn't affect me too badly. Yeah. Then I moved to then at the hospital level. So that was at a personal level. This is at the hospital level. I actually work in Sunway Medical Center. So I'm the one of the 2 full-time psychiatrists. Not many hospitals have full-time psychiatrists. So Sunway Medical Center actually 2 full-time psychiatrists. I handle adult psychiatry, and another colleague, Dr. T, who handles for psychiatric services for children and adolescents. Of course, in a hospital setting, there are a lot of frontliners. Of course, naturally, the nurses, the medical assistant, and all the staff were affected because a lot of patients in the hospital. Naturally, they were affected. There was increased stress, anxiety, worries. Yeah. So I actually took the opportunity to help my fellow colleagues, to help them to reduce stress by introducing mindfulness. So I'm glad that I'm able to introduce mindfulness in the hospital. For instance, we actually came out with a mindfulness program, which is a web-based program specifically for nurses. Okay. I also came out with a YouTube channel specifically on using mindfulness on how healthcare professionals, doctors, nurses, medical assistants, they can use mindfulness in a busy hospital setting to help them reduce stress, to prevent burnout. I also wrote an article on the mental vaccine for COVID-19, not physical vaccine, on mental vaccine. And the hospital was also very nice. They invited me to give talks to the staff on how to take care of mental health. I'm also grateful that the hospital subscribed to an employee assistance program. Mian is the expert. I'm glad that the hospital also has an employee assistance program. If anyone is distressed, they can actually call a counseling hotline. They can call the counseling hotline anytime. And if they need more services, they can consult the clinical psychologist in the hospital. Of course, if they're too severe, they can come to me. So this is at the hospital level, what I did to help the hospital and the staff to take good care of their mental health. Yeah. And every morning when I go to hospital, Of course, you go to hospital, you still have to do the scanning, check the temperature, and you do the declaration. I have this practice that every morning when I pass through the door, pass through the entrance to the hospital, I will actually radiate loving kindness. I radiate loving kindness to everyone in the hospital. Actually, it's a very nice feeling. In fact, sometimes I don't take the lift. I climb the stairs. When I climb the stairs, I radiate loving kindness to everyone in the hospital. I also sing a Rasa Sayang song, which I'm going to teach you later. Is a creative way of practicing loving kindness by singing the Rasa Sayang song. So every morning when I go to the hospital, I get in, after scan my temperature, then as I climb the stairs, I will sing the Rasa Sayang song and radiate loving kindness to everyone in the hospital. After this, I'll share with you. So this is at the hospital level, how I do my part to help to take good care of the mental health of the hospital. So we have to take good care of our mental health. That only we can take good care of the mental health of our patients and clients. Okay, so that was at the hospital level, and this is now at my clinic level. So that's my clinic. As I said, we have 2 full-time psychiatrists, one for adults and one for children. Yeah. I think naturally, a lot of people want to know whether I have more patients or actually less patients during the pandemic year. Actually, other than during the MCO period, of course, MCO period a bit difficult. There were less clients. But other than the MCO period, the clinic was still very, very busy. Not much different. Not more, not less. Not more, not less. And I'm happy that in my hospital, the hospital has a teleconsultation service. Actually, that helps a lot. So a lot of people, they cannot cross district, they cannot come to the hospital. At least we have the teleconsultation service. We can meet online. In fact, for some medication, we can actually deliver to the house as well. Yeah. In the non-MCO period, as I said, clinic was still very busy. And the symptoms that I experienced, the symptoms that patients complain actually not much different. They are more or less the same. They still have insomnia, they still have anxiety, they still have panic attack, they still have conflict, they still have depression. That happened before the pandemic. It also happened after the pandemic. The only difference is the causes and conditions are different. Yeah. So before that, you have insomnia. Now also you have insomnia, but the causes and conditions are different. Of course, naturally, during the pandemic period, all the causes and conditions are mostly related to COVID. For example, they can't sleep, they have panic attack, they have fear, anxiety. They're all COVID-related, MCO-related, isolation-related. Interestingly, some who went for COVID tests, they went for COVID tests again and again and again and again. I still remember there was one client. She checked herself for the COVID twice, not once. Most of us, we go for once. We are quite assured. She went for twice, and she actually wanted to go for the third time. Actually, all the tests were negative, but because she's affected by the anxiety. Yeah. So in terms of symptoms, not much different, but the causes, conditions are all related to COVID. Another one is conflict. Dr. Ong talked about conflict. Yes. Yeah. So there's conflict. Of course, before pandemic also got conflict. Now also got conflict, but now the conflict is related to the MCO. Husband and wife, they stay at home, they quarrel and quarrel. Before that, they quarrel, of course, but they quarrel about other things. They don't quarrel about COVID-related issues. Interestingly, I have one group of patients. They actually like the pandemic. They like the MCO. They like the COVID. It's a group of patients with social anxiety. So people with social anxiety, they like to stay at home. They don't like to interact. They prefer social media. They prefer Zoom. So for them, they are very happy. Because before the pandemic, they feel they are very abnormal. Because so-called normal people interact, normal people go out, normal people socialize. So they will be labeled as having social anxiety or that. So now they're very happy because that's the norm. Everybody stay at home. Yeah. in a way, my personality is also a bit introvert. So also quite comfortable, so I can stay at home, not too many activities. Yeah, those are some of the interesting things I observe in my clinic. Okay, this one I'll skip. Okay, it's one interesting research actually conducted by SunMed. This is online research done by Dr. Eunice, online survey. They actually found that about 30% of the people who responded to the study, 30% had moderate to severe depression, 20% had moderate to severe anxiety, and 15% with both anxiety and depression. It's quite a lot. So about a third, we can say about a third of the population actually have significant anxiety and depression. And the interesting thing, the study also looked at what were the predictors, who is at higher risk now. So the one of the risk factor is age below 25. But the one I suspect, because this study was done online, usually the youngsters are the one who respond to online study. Because the second group, the single, divorce, or widow, not surprisingly. And the third one, this support what Dr. Ong shared earlier, spend more time on social media. So the more time they spend in social media, the more distress, more anxiety, more depression, more stress symptoms. Okay, I will end my sharing by giving you this mental vaccine. I'm not going to give you any physical vaccine. I'm going to give you the 5 mental vaccine. This is something I teach in the Mindful Gym program. So I call it the 5 mindful vitamin, which are the 5 mental vaccine. They are not physical vaccine. They are mental vaccine or emotional vaccine. And these emotional vaccines are in the form of a positive coping statement, which I actually compose from the Buddhist teaching. Yeah. So what are the 5 mental vaccine that we can contemplate, can reflect on the daily basis to help us to improve our mental health? Okay, the first one, we got to constantly remind ourselves we are not alone. Got to remind ourselves. By the way, mindfulness, the word mindfulness has many meanings. I think the most common modern definition is about present moment awareness. But if you look at the Buddhist teaching, the word mindfulness in Pali Sati also has an additional meaning. It has a meaning of remembering. So 5 mindful means remembering the Buddhist teaching, remembering that we are not alone. Of course, pandemic is tough. There are a lot of changes, a lot of challenges, but remind ourselves we are not alone. There are other people with similar condition. We can always support one another. We can always reach out to other people, get help, support one another. We are not alone. The second vaccine is, what can I do? So instead of worry and try to control things that are not within our control, so remind ourselves, what can I do now? Focus on what we can do. There are a lot of things which are not within our control. For example, vaccine. Of course, complication can happen, although it's very, 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 very rare. But the certain thing is not within our control. So instead of wasting our energy worrying, we focus on what we can do. Things that we can't do anything, you try to let go. So that's the second vaccine, or mantra, coping statement. The third one is, we remind ourselves it could have been worse. It can be worse. Like for me, at least I reminded myself, I have the triple gem to guide me. I have my mom to cook for me. Okay? I can still maintain my livelihood, at least for the entire year. I was physically healthy. I was mentally healthy. So I focus on the little blessings, the little good things that happen in my life. Third vaccine, and the fourth vaccine, then we remind ourselves that this shall also pass. The teachings of impermanence. Very sure, this is not going to be the only pandemic. I'm sure there's going to be another pandemic. This will pass, everything will pass, the COVID will pass, pandemic will pass, MCO will pass, everything will pass. Yeah, this shall also pass. Yeah. And the last vaccine is, what have I learned? So pandemic time, a lot of time to reflect, a lot of time to meditate. It's good to ask, what have I learned? I think Dr. Gan earlier, I think one of the slides she shared on her reflection, the things she learned. So I also learned a lot of things, reflect a lot. Yeah, so that's how we, in a way, make good use of the pandemic. Nobody likes the pandemic, but we can learn something from from the pandemic. Just like Dr. Gan, one thing I learned now is wow, so easy to use Zoom these days for Dharma sharing. In fact, the Mindful Gym program, I used to conduct Mindful Gym program twice a year. And each time I can only take 20 to 30 participants. Now I can Zoom. In fact, tomorrow I'm starting the Mindful Gym program and we can take 200 to 250 participants. It's something that I've learned. I think I wouldn't have learned this if there is no pandemic. So with this, I will end my sharing.
Okay. Thank you, Dr. Phang. And of course, thank you, Dr. Gan and Dr. Ong. So such interesting sharing, but as a moderator, I'm getting anxious because we have so many questions submitted by our audience during their registration. And I'm sure there are also questions coming in from the live audience. But nevertheless, let us, move forward from this first part where our three speakers share actually quite extensively, not briefly, quite extensively from each of their perspective. So as we promised, to those of you who registered on Zoom and submitted your question, we will answer them. So this is a segment for that. But before we begin that, let me explain to those of you who submitted your question. I have actually rephrased your question or summarized your question, for the sake of making it more clear, to our panel speaker. So in case like you are wondering why Sister Mian is reading my question the other way around or not complete, so I am telling all of you who submitted your question, I could have rephrased it, summarized it, but the gist is there, or some of the questions, if we are not able to answer this evening, please also forgive us, because there are a lot of questions submitted and I need to pick and choose so that we give priority to those questions that is directed to the topic of our dialogue tonight, which is the COVID-19 pandemic. So the rest of the question, if we didn't manage to answer tonight, we will email you separately, or some of them actually we have actually started emailing you and answering you. So I hope that's where we can attend to every one of you who is supporting this medical dialogue. Okay, let's zoom on to the first question that I have actually organized or listed on my list. And my first question is actually directed to Dr. Gan. And of course, every question that I pose, apart from, the medical professional whom I think will be relevant to answer, but the other two medical professionals, please feel free to chip in if you would like to. So because this is about the vaccination one, that's why I would like Dr. Gan to share with the audience. The question goes this way. In social media, there are news about complications and death after vaccination. So now I'm frightened of vaccination. What to do if I'm taking a high cholesterol medication, or I'm allergic to certain medication like Ponstan, or perhaps I'm a cancer patient experiencing, or if I'm a cancer patient, would I experience side effect resulting from COVID-19 vaccination? So Dr. Gan, this is a long question, about, those of them who are on certain medication, and I think specifically on cancer patient. Over to you, Dr. Gan.
Okay, thank you, Mayan. I think for the person who asked these questions, you must be even more fearful to get COVID-19 infection, from our experience in the hospital. My hospital Tuanku Jaffa, is a COVID hospital. So throughout the pandemic, we closed down half of the hospital to accommodate patients with COVID-19 infections, meaning to say patients with severe stage 3, 4, 5, stage 2, for those with comorbidity, will only get to admit to the hospital. And those who are less severe will get to the district hospital, where open up as a COVID hospital. So if a patients, especially elderly, or those who are about 60 and above, And if they get COVID, and if they have diabetes, they have hypertension, obesity. Obesity is the main issue. For a lot of young people who die of COVID, they're actually obese. High cholesterol and other comorbidities. Once they get COVID, they get severe COVID. And suffer from COVID is very lonely. Like Dr. Phang said, it's a very, very lonely type of disease that you're going to suffer. We as a doctor, I don't take care of COVID ward. I have ID physicians in the hospital who take care of the patients, but we take care of other patients who are not COVID. And then we have to treat every patient as COVID-19 until proven otherwise, including our own colleagues. Now, every day we are isolated throughout the one whole year. Every day we have to eat alone. You know, the spread of COVID is by droplet. So once you mask down and you eat together with your colleague, and then you start talking, the risk of spreading is very high. So all the doctors and the nurses are supposed to be isolated. In our pantry, we only put one small table and one chair, so to prevent the staff from eating, crowding together. If patients get COVID, no visiting, nobody can visit the patients. And also once you are admitted to ICU, and thanks to, you know, now there's this media called handphone, you can video call. Most relatives are allowed to video call their family member. That's how they contact each other, but you are not allowed to visit them. And a lot of time before the doctors, you know, put in assisting tube the patients when they need machines to help them to ventilate. That is the last call. We actually do this call, you know, very compassionate to let the family has last time seeing their loved one for the last time before we tube them. And it's actually very sad movement if you experience that. If they're able to make it, they make it. If they are not able to make it, that is the last time you see your loved one alive that way. And if they pass away, we will treat. It's very infectious. The treatment is like patient pass away with HIV. The hospital will quickly wash the patients and wrap up the patients in layers, and you were not able to see them for the last time, and quickly were sent to burial ground, whatever ceremony that you have, and then that's it. Okay, will not be able to take home for any ceremony. So that is how patients who suffer from COVID have to do it alone, do it that way. And many patients actually very depressed. So many patients, when you are so long in the hospital, you stay in the open ward with all the patients with COVID, you actually feel very lonely and feel very depressed. Also hospital food, we don't allow any outside food also, you know, you cannot call Grab food because nobody can send the food up to the ward for the patients. So you just have to make use with the hospital food, and it's very sad. So it's not nice to get COVID. So how about vaccine? Now we have an options. Why are you so scared about these vaccines? So as I showed you all earlier, so about 100,000 Malaysians getting COVID-19 now, you know, in a month. And this figure is underestimated. And if you get COVID, about 4 people per 1,000 is going to die, more so with those who are elderly. If you get vaccination, anyone died so far? Nobody. So and then you also possible get this condition called long COVID. whether you are young, whether you are old, the post-sequelae of COVID, nobody knows who's going to get who, but there's possibility that a person may get long COVID. And so far, we have so much of restrictions in our life, isn't it? We long to go back to see Mian in person, you know, have not met her. You know, now we're only able to meet that way. I have not met my sister and brother for so long. They live in KL. They cannot cross the state. They can't even come back during Chinese New Year. I can't see my grandmother, who is 94 years old, back in Pahang for 1 whole year. You see, so we are all longing to meet our loved one, go and see them, and so on. So with COVID, there's a lot of restriction in life, no doubt. As a doctor, I actually quite like this. I just come home, go to work, come home, go to work. I no need to go anywhere. I have lots of opportunity to learn Dharma during this 1 whole year. And you can learn more things. There's not, before this, it's not possible for me to join any online retreat, a retreat in the center, but now there's online retreat. I think so many of us able to do that. And you can capture even more people, like Dr. Phang say now 250, you know, joining his workshop. Before that is only 20. So the outreach is even more, like tonight's outreach. You can go to, you know, use YouTube, use this and that. But is that what we want? We have to ask ourselves. So if we doesn't want this, how else we can protect ourselves and we can protect others and the elder at home and also protect our community? Okay, so I think the vaccines is the answer to that. So far in Malaysia, we have supposed to buy these 5 vaccines, and only 3 so far has approved by the Drug Authority, MPRA, National Pharmaceutical Regulatory Agency. And so far, the one in use is the one by Pfizer, the mRNA. I think many people, you all has know everything about the types of vaccines, so I don't spend more time talking about this. But what you need to know, it is very good. The efficacy able to protect up to 95%. What does that mean? I will explain a little bit more later. But I think most important, like Dr. Ong just now mentions, there are so many fake news. There are so many news which it has not been verified and posted out in the media. When you are on WhatsApp, on whatever, every day, and then you see your friends, I heard this, I heard that, you know, these people died, that people died due to COVID. And before we verify, we again blast out, send to our friends. So that create a lot of fear. So one of the fake news, you know, like all these benigners died of COVID-19 after the vaccinations, and firemen died of COVID-19 after vaccinations. So all this sort of news increase our anxiety about the vaccines. So I think as a Buddhist, like what Buddha's teaching, investigate. Don't simply believe what people say. You probably should go to a good website with very reliable, like we go to CDC, go to UpToDate to look at the proper news, whether this one come out from a verified authority and any scientific evidence before we actually believe in it. So as up to yesterday, you know, in Malaysia, if you think giving vaccine is like guinea pig, so all of us has been guinea pig. And there are about 770 so-called frontliner has been vaccinated, and about 200, near 300,000, I think, up to today, has received the complete 2nd dose of vaccine. And of course, I'm also one of them. So what this vaccine can do to us, okay? So if you are vaccinated, you are actually protected from getting severe COVID, that is for sure. You will not get severe COVID. So you will not need to admit to the hospital, suffer from this and resulting in death. I think that is for sure. You may get COVID infection again, but at the low infectivities. So I think yesterday I read some, before this, we are not very sure whether once you get COVID vaccinations, once you get COVID infection again, you can infect other people or not. There are some papers say that because the infectivity that we're going to get, you're going to get a very mild COVID. The viral load will be so small that you may not able to infect other people. I think that is a very good news. If that is proven, then after those vaccinated may be able to mask down. I'm not very sure, but at the time being, you are still not able to mask down because there's also variant strains coming in. We are vaccinated for the original COVID coronavirus, and there are also different wild types now coming in. We still need to protect ourselves from getting those infections. So government has come out with this. As per last week, our health minister mentioned that you know, if you get vaccinated, usually you get very mild symptoms because it's intramuscular injections. So 80% of people will get a bit of injection site pain, just like any, you know, if you have you been to flu jab for the flu vaccination, it's exactly like that. In fact, personally, at my personal level, I actually reacted very badly on flu vaccines. But for COVID vaccine, I'm perfectly okay. For me, I'm perfectly okay. 60% get a little bit of fatigue. About 50% get a bit of headaches. 10% get some swelling at the injection site, which usually lasts only for mild suffering for 2 days. If anything severe happened to you, then government going to have some financial assistance to you, 50,000, and if cause death and permanent disability come to 500,000. Okay, so this is small thing and nobody want it to happen to us, right? So up to yesterday data, out of the 700,000 people vaccinated in Malaysia, only 3.5% the vaccine recipient experienced mild to serious side effect. At my hospital level and what I heard from the whole Malaysia level in our doctors group, I think so far we don't really get true anaphylaxis. There are few people who, you know, get a bit of reactions. 1 or 2 people need to admit to the hospital just for observations, but the next day they are being discharged. So far nobody died of anaphylaxis, okay? So these are very common side effects that I've mentioned just now. Usually last 1 to 2 days. And some say after second shot, you may get a little bit more side effect. But I think this is personal. For me, after first jab, after first day, I get a little bit of pain over my shoulders. And the second day, a little bit increase, and third day, I'm okay. But for second injections, I have learned from my first injections, I come back. You know, you exercise your arm, the side that you inject, it actually cut down, you know, reduce so much of pain. So I have some discomfort the next day, and then after that, I'm perfectly okay. So of course, I have friends and colleagues who has developed some flu-like mild symptoms. 1 or 2 have mild fever, but all last less than 2 days. So I presume this is nice to get this, you know. If you get this, these are vaccine passport. So hopefully you will be able to cross state. Maybe you can travel to nearby countries. I think soon the ministry will also announce, without this, you can now go to shopping complex. You have not more movement restrictions without this COVID certificate. So there's another good, I think the COVID vaccine thingy, every day there are news. These are the last update I get from yesterday publications about the Pfizer vaccine, which now we have experienced about 6 months experience. And before this, we know the vaccine must keep in the fridge at a temperature of minus 75 degrees, isn't it? So up to yesterday report, the FDA has approved the storage in between minus 25 to minus 15. So you no need minus 75. And once you thaw it, you take out the vaccines, you can keep it in the normal fridge temperature between 2 to 8, according to them, for a month. But in the hospital level, now we still practice, once we take it out within a week, we'll finish off the vaccine. So I think no issue about the temperature, but the very good things to show us in clinical trial, the vaccine
Dr.
able
Gan,
to protect.
Dr. Gan,
Yes.
I may need to interrupt you. Yeah, because I think I have a lot of questions that I need you guys to answer.
So I just basically want to tell you the vaccine is very safe. So you should go for it. You shouldn't have a lot of fear. So the benefit that you get from vaccinations is much more compared to the side effect that you're going to endure for only 2 days. Okay. And as for the allergy, the only contraindications to get vaccination is actually if you are allergic to the component in the vaccine called PEG, a effect globule, which carry the mRNA messenger when they inject into us. So many people actually allergic to this PEG. So other than that, if you have a severe allergy, anaphylactic response to other medication before, we still able to give you injections, but you can request to get it injected in the hospital under safer environment, and the doctor will able to assess you. If you have mild allergy to brufen, if you are taking cholesterol drugs, taking hypertension, diabetes drug, there's no problem at all to get the vaccines. The cancer patients who are already treated, who are not currently under chemotherapy, I think there's also no issue in getting the vaccine, including my patient. My patients are considered immunocompromised patients, and they are all able to take the vaccines. We advise all our patients who are on immunosuppressant to take the vaccines. Just need to have a minor few drug adjustment that we will advise it to our patients, but there's no problem in getting the vaccine. Okay, Mayan?
Okay. Thank you so much, Dr. Gan, for your so extensive explanation. It's actually very interesting, but I'm pressed for time because or else, we are not able to cover the audience question.
10 seconds, just to add something. Can I have 10 seconds?
Yeah, and
Can I
Dr.
have 10
Phang,
seconds?
Dr. Phang, in fact, the next question is quite related, which I wanted you to answer in line with what Dr. Gan have shared. Yeah, it is actually the phobia of going out, the phobia of being summoned, how to actually remove this phobia. So because I think this is quite interrelated and you can answer it together with your comment with Dr. Gan. Can you do that? Thanks.
I will. Just to add on Dr. Gan's part, this is specifically for those who are on treatment for any form of mental health disorder. If you're on treatment for anxiety, depression, or schizophrenia, or bipolar, is it okay to take the vaccine or not okay to take the vaccine? Okay. I written a simple guideline which I post in the KL Buddhist Mental Health Association Facebook. I will give the link later. But in summary, it's okay. Regards to the fear about being summoned or those things, you see that our fear is very funny. Our fear is very irrational. Yeah. Of course, Dr. Gan has given us a very convincing statistic that the death rate is very low, complication risk is very low, everything very low, everything okay. Yeah, Dr. Kar already vaccinated, Dr. Ong also vaccinated, all the vaccinated, but all those at the logic level, you know, fear is irrational, fear is illogical. Of course, getting the facts is important, but sometimes we need another method to complement the factual way, which is getting the correct information, which is important, but it's good to complement it with some emotional regulation method. Yeah, so I'm going to share with you a method called, I call it the butterfly hug. Butterfly hug meta version, and this is a very simple practice that can help us to reduce our fear. Fear in any form, not necessarily the one related to someone, any form. If you are exposed to news, you get terrified, or any form of fear related to COVID, you can use this method. Okay, so how do we do that? Okay, so as the name of the practice implies, it's called butterfly hug. So we use our hand to form a butterfly shape this way, and then we hug ourselves in this way. Can you see? Hug ourselves. So like butterfly, use the hand, make a butterfly shape, hug ourselves. Okay, and then we gently tap ourselves in this way. Alternatively, one left, one right, one left, one right. Okay, and as we are tapping, we try to be mindful. That will also mean we pay attention to the touch sensations and the sound. Gently tap, left, right, left, right, left, right. And the mindset is as though we are comforting ourselves, we are soothing ourselves. Butterfly, ourselves, okay? And then the important part, the meta part, remember just now I said I will share with you the way to radiate loving kindness using the Rasa Sayang style. Okay, so as I'm hugging myself, I will sing the Rasa Sayang song. Okay, this is how it sounds. Rasa sayang hey, rasa sayang sayang hey, hey may I, may you, may all be happy, happy, happy. May I, may you, may all be happy, happy, happy. Okay. So the lyrics are may I, may you, may all be happy, happy, happy. So it's positive wishing. Basically, it's a loving kindness practice. It's just that we do it in a creative way with the butterfly heart. May I, may you, may all be happy, happy, happy. Okay, then you can take a deep breath, breathe in, and you breathe out. Breathe in, breathe out, breathe in, and breathe out. Okay, looks very simple. There are a lot of therapeutic factors in this simple practice. Okay, one of them is actually this butterfly hug originates from a modern psychotherapy method called EMDR, which is used to help people with trauma. Okay, of course, and also for those who are familiar with acupressure, when we do this, we're actually tapping on two very important acupressure points, which are related to relaxation and calmness, which are the K27 point. There's also another point here. Sometimes after you do the hugging, you do a bit of gentle stroking this way. So you activate the two very important acupressure points, K27 and the C of tranquility. Of course, there's also a power of loving kindness, metta. As we sing a song, we're really radiating loving kindness. We activate certain positive neurohormones in the body, like the oxytocin, which has the opposite effect of fear. Oxytocin helps us to bond, help us to connect, help us to feel safe. Okay, so may I, may you, may all be happy, happy, happy. Sister Tan, I like the way you do it.
Yeah, Sister Libby is really translating your whole exercise. Yeah, thank you, Dr. Phang. Yeah. I would like to invite, I think the flow is so nice, to do another question that is also related to this, that one of the audience actually asked as part of the impact of COVID-19 pandemic, which is the fear of death in relating to meditation practice. Yeah, since Dr. Phang was teaching us this exercise, I'm going to invite Dr. Ong perhaps to add on from our Buddhist meditative perspective. Is there any specific meditation practice that could also support us in managing our phobia and fear? Dr. Ong?
Yeah, thank you, Sister Mian. Actually, the Buddha's teaching has a lot to teach us about managing our thoughts and our emotions. And in fact, the most important skills that I know of, okay, that I use in my own personal cultivation is mindfulness. You know, the mindfulness practice is the one that Dr. Phang and Sister Mian have been teaching this over the internet, over social media for so many sessions already. But this we shouldn't take we shouldn't look at mindfulness or belittle mindfulness. It is actually a very, very powerful tool. The way I use mindfulness to manage my emotions, any kind of emotions, be it fear, phobia, anger, anxieties, anything, it works similarly with this mindfulness. And what happens is that before you can manage your emotions, before you can manage any negative emotions, you got to be able to be aware of that emotion. And the sooner you're aware of the emotion, the easier it is for you to manage it. Okay. And mindfulness is one tool that can help us to notice our thoughts and our feelings at a very early stage. Right. And once you have that awareness, then you can do something about it. And here, the way I practice it is I bring in the sixth pillar of the Noble Eightfold Path, which is right effort, where if you have negative thoughts, then if you are aware that the negative thoughts is arising, you stop it or you replace it with any opposite positive thoughts. And here, actually, in the suttas, the Buddha gave quite a number of methods to deal with negative thoughts. If you look at Majjhima Nikaya number 20 in a sutta called Vittaka Santara Sutta, the Buddha actually listed 5 methods to deal with negative thoughts, right? And the first method is, if you have anything negative, when you are aware of it, you replace it with the opposite positive thoughts. So for example, if you have fear arising, you start to practice metta, radiation of metta. If you have anger arising, you also can practice metta or peace or tranquility. So the first method is replacing a negative thoughts or a negative emotions with a positive one, right? The second method is reflecting on the negative effect of persisting with this negative emotion and negative thoughts. Okay? The third method is to not feed these negative thoughts with more attention and energy. So these are 3 of the methods that I commonly use. But there are 2 other methods where the Buddha says, if your mind is running too fast towards the negative thoughts, then slow it down. And he gave the analogy of, if you are running, start walking. If you are walking, stand still. If you are standing still, sit down. So basically he is saying, slow down your thoughts. Slow down your thoughts. And lastly, he says, if everything else fails, then you just have to use brute force to stop the negative thoughts. So these are the 5 methods that you find in the suttas the Buddha has given to manage negative thoughts. So yeah, when you use these methods or any one of these methods, with enough mindfulness, you can stop your negative emotions or negative thoughts. This is the way I use it.
Okay, thank you, Dr. Ong, for that. Yeah, let me at this junction, what I'm trying to do is that I'm going to invite all our audience, be it on the Zoom, YouTube, or Facebook. If you have any question that you would like to ask our speaker, because so far we are only addressing the pre-submitted question, please send them in now. Because as I pose the next question to our speaker to actually share with you guys, what I'll do is that I will go through all the incoming live questions, and if it's interrelated, I will immediately connect it to our discussion. Yeah, so this is to save time. So I invite Zoom audience, you can type your question on the chat box, or of course, those on YouTube or Facebook, yeah, do that. And our technical team will try their best to get the question to me, yeah, via Zoom. So please pour in all your questions, because I can already see a lot of the question interrelated. Yeah, so while you do that, yeah, I'm going to pose the next question. So as our three esteemed speaker discuss, debate, clarify and share more information with you, then I can actually screen through the question and then post to them after this new question I'm posing them now. So for our three esteemed speakers now, after I've invited one by one, for you to address a specific question, my next question, not mine actually, the audience question, I think is a very good question where the three of you can actually chip in, take turns to share upon it. It's a huge, actually, question. Yeah. In looking at this pandemic, what are the health and mental health impact across different age group, gender, and which of the group are more vulnerable, and what type of help are needed or suitable for them? Some of it has been touched by your slides, I can see that. But of course, I think this is where I need three of you to perhaps re-emphasize for the audience. Yeah. So what are the health and mental health impact across different age group and gender? So age group and gender. And out of this, who are the vulnerable one, and what type of help would be suitable or needed for them? So over to you, my three esteemed speakers. Whoever wants to start first.
Okay, maybe I will start first, since I did discuss this in my slides. I think this pandemic has affected everyone across all the levels of society, rich and poor, old and young. But the one that were most impacted are the elderly, especially the elderly who are alone and who are suddenly without the family support. Okay, and they need special attention and people to reach out to them. So that is one group of people who were badly affected. And the other group of people who were badly affected, but probably they are able to adapt much better, are the kids. Despite the fact that they have no physical schooling, they also miss out on interaction with their friends and miss out on any outdoor activities. But I suppose because children are so adaptable, and they are so adaptable now to social media and the computer, they have an outlet. The disadvantage will be children from poor background who do not have internet access or do not have the computer. Right? Among the genders, I think the women are more affected generally psychologically than the men, because they have to take care of a lot of family matters, preparing food for the family, and having to cope with stress from the spouse as well as the kids. Men are not exempted from the stress as well, because for most men, when the economy struck so badly, financial stress was a big thing. So everyone is affected in various degrees, and whether it is bad or not depends on how you cope. Like Dr. Phang says, some people actually enjoy the pandemic because of various reasons. So the pandemic not only affected various groups in particular ways, it can also, for some, be an opportunity, right? But to answer the question, a short answer is, it affected the elderly badly, it affected the children badly, it affected mainly the women compared to the men as far as gender is concerned.
Yeah,
anyone
Dr.
else
Phang,
need to want to
Dr.
chip
Phang
in?
or Dr. Gan want to chip in? Dr. Gan, you are mute, Dr. Gan. In case you're speaking, Dr. Gan, you're mute.
Okay, I will talk a bit on the impact on our healthcare workers. Over the one whole year, the hospital system has changed tremendously. You know, the surgical, the orthopedic, the operations has all give way to medical and to treat the COVID patients. So therefore, all the elective operations has all been stopped or postponed. They only cater for any emergency operations. So in years to come, there will be a lot of backlog for these operations. And because people are also so fearful about COVID-19 infections, like Dr. Ong said, many of us were so scared initially to go to hospital. And on our level, we actually teleconsult our patients. We send medications to them. And many people over this year, the fear has less, I think. People start coming to hospital. Hospital now has become very, very crowded. And because of lack of medications for a few months last year, and many diseases actually flared up. And because of also fear to come to hospital, we found the admission rate actually is lower, but the problem is people come very late. You know, those who came forward for treatments are all very ill patients. They wait at home sick for a week or two until they, you know, cannot stand anymore. Then only they come to hospital. That's why the mortality death rate is also higher. And you can see also quite a number of people actually brought in death because of COVID. And these people were so fearful and they wouldn't dare to come to hospital. And over 1 year, the training has stopped for several months. The medical students are not allowed to come to hospital to practice. The house officer training, I think, is also never as good as before. If they go for surgical posting, they never get to assist in any operation. I also don't know what sort of training they have gone through. And can you imagine the whole Malaysia over last 1 year, we don't produce any specialists? Yeah, because there's no MRCP PACES exam. There are 200 plus people in queue, you know, waiting for this exam. So the exam may be resumed back end of this year. So nearly 1 year, 9 months, we do not produce any specialists. So therefore, subspecialty training will be also affected. So doctors' career path training and so on will be all actually affected. And most important, our resources, constraint of resources. So much money has pumped into COVID. Everything is COVID. So every other medication is no extra budget, cut. So our hands are also quite tight in treating our patients. Those are some of the impact The teachings for last 1 year, teachings are all online. Our CME are all on Zoom, and very sad to say that because the new doctor come in, all face wear mask, and we have stopped our grand ward round, so it's just a limited doctor to see the patients and so on. So many times now also we don't recognize our own doctor, you know, and yeah, wearing mask all the time. New doctor come in, we don't meet them in the clinic, we don't meet them in the pantry. You cannot sit together and eat, you cannot go so near to talk. So social and many other issues that we are facing as a healthcare worker.
Thank you, Dr. Gan. Dr. Phang, would you like to add on?
I'd like to add on a little bit on what Dr. Ong mentioned earlier, that actually there are some studies to suggest that women are more affected. And I'm sure in your talk, you probably come across in the literature, some studies show that actually women are more affected. This is particularly true when we are the victim of domestic violence. Right? That is one high-risk group, women who are victims of domestic violence. Women who are working, cause more challenges in balancing work and life. So there is a work from home. There's also a home work from home. So there's a higher risk for women to end up with mental health conditions. Also, women who are expecting, also in the postpartum period. Yeah, so women have higher risk. Another group would be those on treatment for severe mental illness like schizophrenia, bipolar, severe depression. That's also a vulnerable group, especially if they come with, especially they have poor psychosocial support, and especially they have chronic physical illness as well. And it's not uncommon because having mental health condition actually put them at risk of a physical condition. So you have severe mental illness plus chronic physical illness plus poor psychosocial support. She very high risk. Yeah, that's all.
Okay, thank you, Dr. Phang. Yeah, for those Zoom audience, I would suggest that you do check the chat box because our esteemed speakers, some of them have actually answered you in the chat box. Yeah, so do check the chat box. And I can actually see quite a number of questions regarding vaccination. I may have to let it be, and perhaps we, the speaker panel, we will get together later on and see how we can compile the relevant information, and we can always post it on our Theravada Buddhist Council Malaysia Facebook page, the information. Yeah, there's quite a lot on vaccination. So because I do not want this dialogue to be swamped only with vaccination question. Yeah, the moderator have a tough job so that we have a balanced, type of question to be discussed. Yeah. So I hope you don't mind that I'm not reading out the question as you're posing it. Yeah. So thank you to our three speakers. And my next question that I've prepared from the audience is actually quite a continuous flow from what you all have actually shared just now regarding the age group, the gender group, the vulnerable group, or what type of help that is needed. This next question is much more specific. What would be the topic that could be relevant or helpful that we could look at in terms of our community education in managing this pandemic? Meaning to say that outreach for the community, outreach for the workplace. Yeah, what would be some of the relevant topics apart from the vaccination, which is the hot topic now? Yeah, but what are the other topics that as a Buddhist community, and there are many Buddhist leaders in our audience today, that we need to prepare ourselves so that we can prepare all this topic, to reach out to not only Buddhist community but to the community in general. Yeah. So perhaps you guys can highlight some of the topics. I will also highlight some that we can take on from today's medical dialogue to work on so that we can continue our outreach to the community. Anyone? Dr.
Okay,
Ong,
I
go
think
ahead.
I will start this off. But I think actually the right person to answer this question is actually Sister Mian herself, because you have done so much work in this area. But let me start off anyway. I think one thing we need to do moving forward is to get accurate, up-to-date information to the community. I think we cannot be basing our behavior on all outdated information. If you continue to do that, then we are really losing out. So we need to be updated with the right information, accurate information. So we have to check our sources. So if you are unsure, go to the official sites. Okay? Because I think a lot of unnecessary fear is being generated through fake news, misinformation, misdirection, things like that. So it is our task, and that is also the reason why we have this forum today, to help to bring about up-to-date, accurate information to the masses. I think that is one area we can focus on. The other area we can focus on is to teach those people who are under stress some self-help, self-care methods. Okay, self-care for both the body as well as for the mind. Right. Very simple self-care methods for the body is to make sure that you are eating right, nutritionally balanced, you are having, you're drinking well, enough water every day, and you sleep well, you get your regular exercises. These are simple things that you can do to take care of your physical body. Then mental health. I think mental health, I will leave it to the experts to elaborate on that. Then the third thing is what the Buddhist community themselves can do is outreach to those who are in need. And I think we are already seeing this even as early as when the pandemic first struck. We are already seeing quite a lot of Buddhist organizations, not just Buddhist organizations, to be fair, because all the other organizations across the country as well, a lot of NGOs and other religious organizations as well, have been doing their parts to reach out to the needy. So these are all very encouraging things that we need to continue to do. But we are not just going to be focusing on physical needs, because we need to also focus on their mental needs, their psychological needs. I think that let's let the others. Mm-hmm.
Yeah, thanks, Dr. Ong. Yeah, Dr. Gan and Dr. Phang, please add on.
Yeah, I just add on a bit on the self-care method. As we know, a lot of morbidity occur in people who are obese. So I think this is an opportunity for those who are overweight, try to reduce weight. So in case you get COVID, hopefully it cut down your morbidity. And healthy lifestyle is an opportunity when this pandemic, maybe for those who cook at home, you eat less outside, you see your body weight has actually come down. Yeah, so you got to believe you are what you eat. So when you eat out with all the saturated fat, all the high carbo diet, you become obese. And once you choose to eat at home with home cooked food, and then many of my patients actually the weight come down, the blood pressure come down, the diabetes become better controlled. There's another aspect is sleep well. So sleep early. Try not to use your social device again after 10, and if possible, sleep before 11. They in US they do some study, you know, and especially those who sleep very well, the body immune response actually much better. Especially for those who are going for COVID immunizations on the phase 2 and phase 3, you must prepare yourself for a good night's sleep if tomorrow you're going for vaccinations. And they found that if you have a good 7 hours or good night's sleep, you actually get less side effect from the vaccination. So how about people want to ask, is there anything that you can supplement yourself to prevent COVID. There's nothing that you can supplement yourself to prevent COVID, except follow the SOP, wearing masks, all those is the best. But they do the study between our mortality is much lower compared to the Western country where they have winter and so on. They found vitamin D deficiency in them, actually resulting in much more severe COVID. So many people have some vitamin D supplements at the correct level may be helpful. I think so far that is the only something positive about vitamin D supplements. Mind you, in Malaysia, we have hot sun, but so many of us never go out under the hot sun half an hour every day to sunbathe ourselves to get enough vitamin D. And many of us, if you check your vitamin D level, you may be a vitamin D deficiency. So other like zinc and many other things have no evidence so far. The only small evidence is on vitamin D and good sleep.
Thank you, Dr. Gan. Dr. Phang?
I just want to add on the use of mindfulness. Mindfulness, we are all Buddhists, so to emphasize mindfulness. Mindfulness is very useful for physical self-care, also for emotional self-care. So before the forum afternoon, actually I did a literature search. Actually, there have been studies in Wuhan, studies in Italy, studies in US. They actually have shown scientifically that the practice of mindfulness helps to reduce stress, anxiety, to help with the sleep, and to promote mental health. Yeah. So in Malaysia, the easiest way for you to learn mindfulness, and by the way, online mindfulness training has been shown because pandemic MCO is very difficult to have face-to-face sessions. So they are shown actually online session is good enough. Yeah. So afterwards, I will give you a link on the Mindful Gym program. For those who are hearing Mindful Gym for the first time, Mindful Gym is our made in Malaysia mindfulness program, which have been scientifically studied in our local population. At the moment, there are more than 10 scientific studies locally in Malaysia. So I'll give you the link. Mindful Gym program is available on YouTube. So I'll give you the link to the Mindful Gym program YouTube afterwards in the chat box. The second thing I want to add is I think one of the topics that we can consider is to have talks related to anger management. I think one of the observations are seeing that people are getting more and more angry, more easily irritable. So something on anger management. In fact, next coming Wednesday, I'm going to give a talk on anger management, the Buddhist advice, that is organized under the Buddhist Missionary Society of Malaysia. Please allow me to share the slide. They just made the poster. Okay, let me see. Can you see the poster? The Buddhist teaching on anger management, 7 April, coming Wednesday. Yeah. So those of you who are interested, can attend the talk. Okay, you can take a picture. I'll post this in the Kuala Lumpur Buddhist Mental Health Association Facebook as well. Yeah, thank you.
Thank you, Dr. Phang, Dr. Gan, and Dr. Ong. And need the permission from the audience. We have overshoot our 10 p.m., but looks like we're going to overflow a little bit more. Yeah, please bear with us. But this discussion is still ongoing with comments and questions coming in, and we may need to have a separate dialogue actually addressing more on the vaccination topic. But nevertheless, yeah, talking about what can we do next. Yeah. Due to time shortage, I would not share in detail, the topics that I have been teaching, but I focus a lot actually on building resilience for the workplace. Yeah, I do a lot of training for the companies or the corporate company looking at the employee stresses. Yeah. So I will post, I've even done a lot of actually short session, half an hour, 1 hour on different topic for the workplace on how they can actually learn to manage themselves as an employee facing stress, how they can manage interpersonal challenges at workplace, which conflict at workplace is very dangerous. And the third one, actually very important, looking at the volatile economy and the workplace. And of course, we have actually seen retrenchment ongoing and the impact on the employee population. How do we, even before, such thing impact us, to understand about change and transition, within ourselves, within the workplace? What are the steps or what are the practices that we can actually do to minimize or reduce the impact of this major change and transition that is affecting us as a working population? So over the last 1 year plus, I've actually done a lot of this area, especially targeting the workplace. What I will do is that I will post all the relevant available YouTube video, on the Theravada Buddhist Council, and also on my own Facebook, so that you can go and pick and choose the relevant topic and share it with your friends, especially the working population. But naturally, it won't run away far from what we have discussed today, the impact on the different age group, gender, different population, right? Just that my focus is very specific on the workplaces. So I'm very mindful, because if once I start sharing, I'll be very passionate and we may hit until 10:30, which we would not want to, because Dr. Gan reminded us we better go to bed before 11. So what we will do is that I will go one last round, that I invite our 3 esteemed speakers, if they have any other words of wisdom, one word or one sentence summary that they would like all of you audience to take home with after attending this dialogue with our Buddhist medical practitioner. And then, of course, I would need to pass back to Didi Ling Huat to do our closing, and very importantly, our sharing of merits, because all of us have made a great effort to be here to share not only medical knowledge, but Dharma knowledge. So let me do the rounds first for our esteemed speakers, words of wisdom. Anyone would like to start first?
Okay, so medically, clinically, I think most important that we need to protect ourselves from getting COVID, and therefore you protect others from getting COVID and spread the disease. The only very effective way that you can do it now is follow the SOP. There's no, people don't simply just set the SOP. Wearing mask is very important. The study shown that if a person with COVID-19 positive talk to you, and if he's wearing his mask properly, and you are wearing your mask properly, the chances that he's going to infect you is only about less than 5%. So if he's masked down, you put on mask, is about 50%. You see? So my personal experience is in the hospital, all of us will get swabbed few times, because every time there's one doctor positive, we all get swabbed and so on. And my personal trainee who is COVID positive, who is sitting same room with me and has very high infectivity. But we follow strict SOP. We never put our mask down. She's sitting same room with me about 1 meter apart. When she tested positive for COVID, I tested repeated swab negative. All the patients seen by them also negative. But when she was home, her husband, her daughter, all masked down, all got infected. She invited her mom come over to her house just for dinner. The mom and the sister infected. The brother, only one dinner, they sit together and eat. The brothers, the sister-in-law, the whole family get infected. So you can see the power of wearing mask. Wearing properly, and you got to change your mask very often. And I think that's my message. And you got the opportunity, please register yourself in my Sejahtera, and your turn will come for the COVID-19 vaccine. As you say, that is the only way to prevent you from getting severe COVID if you still do get COVID.
Thank you. Thank you, Dr. Gan. Dr. Ong?
Okay, I think I have two short messages for our audience. Number one, yes, I encourage everyone to sign up to be vaccinated because the benefits of vaccination outweighs the side effect. So regardless of your age, your morbidities, your risk factors, sign up. Don't worry. The people who are organizing this vaccination, they will screen through you and make sure that you are safe. In fact, they are even more worried about anything happening to those people vaccinated because, you know, nothing gets hidden nowadays. The news is so fast. So they are even more cautious. So you don't have to worry. Let them do the worry for you. Just sign up and get vaccinated. That is one message. The other message I wanted to share is also actually in every adversity there is also an opportunity. So we can also take this as an opportunity to better ourselves, transform ourselves. And in fact, you will notice that people who have been doing their own mental development, mental cultivation, they fare much better in this pandemic. So why not we do the same? Okay, so take this opportunity to better yourself by cultivating your mind. Make it strong. Make sure you have mental resilience, mental strength. And I think if you can achieve just this much, it would have been a great achievement already. That's all.
Thank you, Dr. Ong. Dr. Phang?
Yes, go for vaccine. Definitely. Don't forget the mental vaccine I mentioned. So COVID vaccine is for physical protection. It's also important to protect our mental health. Yeah. So if you have time, go through the 5 mental vaccines I mentioned earlier. I will give a link. I remember I written an article as well on the 5 mental vaccine. I will give the link afterwards. So just to recap, the 5 mental vaccine, the 5 positive coping statements are: I'm not alone. It could have been worse. What can I do? What have I learned? And one more. What have I learned?
These two shall
What
pass.
can I do now?
Pass.
And this two, yeah. So those 5 mental vaccines, it's like a chanting every day. I chant. Like chanting Namo Tassa. So it could have been worse. What can I do now? This shall also pass. What have I learned? What can I do? So you can make it in the form of chanting. That's mindfulness practice, remembering the Buddha's teaching. So that's one message. Another one, one final tip. Also, I've learned this. There's a coping method called RAIN. RAIN symbolically represents hardship, challenges performed in life. So RAIN is an acronym. So R means recognize our stress level. Dr. Ong talked about importance of mindfulness, to be aware. So everything starts from awareness. So R, RAIN, R starts from recognizing that we have stress, mental and physical. Okay, then the next one is A, ayam. A means acceptance. Okay, acceptance with kindness. That's very important. So we accept that we are stressed up, and then the kindness part, we can do chanting, we can do walking meditation, we can do mindful breathing, body stretching, yoga, qigong. There are many things that we can do to be kind to ourselves. So that is acceptance with kindness. So that's A. Okay. Then the next is I. Rain, rumah, ayam, I. I is identify resources, identify help. Now we are not alone. There are many people who have similar problem like us. We can always identify resources and help. In a way, going for the vaccine, physical vaccine and mental vaccine are identifying resources and identify help. And the final one is N. Okay? And I connect with the Buddha's teaching. The first N is not alone. I'm not alone. Yeah, we are all taking the vaccine. We are all going through the pandemic together. We are not alone. So that reflection is a good antidote of this feeling of isolation, sense of isolation. So we remind ourselves, you're not alone. So the first N is not alone. Of course, the second N is not forever, not permanent. So that's consistent with the Buddha's teachings of anicca, impermanent. R, rain. R for recognize stress. A for accepting the stress with kindness. I for identify help or resources. And N for remind ourselves you're not alone and not forever. Yeah, thank you.
Thank you, Dr. Phang. And before I pass back to Didi Ling Huat to do the closing, this is my summary or my word of wisdom for all our audience today. So this is from actually our late Chief Venerable Kesri Dhammananda. And this is actually my vaccine because I recite this every night before I go to sleep. I would like to share with you all this short phrase of aspiration from our late Chief. Yeah, you can recite together with me if you would like to. Yeah, I will use we instead of I in our recitation so that we can actually do this aspiration together. If we have strayed from the true path, may we never do so again. If we have carelessly hurt someone today by word or deed, may we be more mindful the next time. O Buddha, the enlightened one, help us to set our heart right. May our action reflect your love and compassion. We shall strive to cleanse our heart from hate and envy and live in harmony with all people. We shall be close to the Dharma in good as well as in difficult time. We know that should the moment come for us to leave this world to say goodbye, at least we shall do so without fear or regret, because we will leave this world a better person than when we came into it, because we have been enriched with so much Dharma. Whatever wrong someone may have done to us, may we be compassionate and forgive and bear no hatred in our heart. We shall bear in mind to be grateful too toward all the acts of love and consideration shown to us by others, no matter how small they appear to be. To those we love and those who love us, may this life be a blessing and a source of happiness to all beings. Namo Buddhaya. So this is a beautiful aspiration. This is my vaccine. Yeah. So I hope this will be also a Dharma vaccine for all of you. And with this, I end my duty for tonight as the moderator of this dialogue. And I'll pass back to Didi Ling Huat to do the closing officially on behalf of Theravada Buddhist Council, Malaysia. Over to you, Didi Ling Huat.
Yeah, that was a wonderful moderating. Huh? And also, I think that was my shortest 2 hours. It was so interesting that the 2 hours just flew by. I was writing a lot of points, actually earlier. But then your last 1 minute summary, all three speakers focus on the vaccine. I noticed that. So vaccine is to protect ourselves and to protect others. So let me share with you a short story from Jataka. So that you remember how to protect yourself and protect others. Why is it important? There was an acrobat. I'm going to make the story very short to only 2 or 3 sentences. Time is so limited for me. There was an acrobat who actually was trying to, balance the pole on his forehead. And he got an apprentice to climb on the pole with a knife. Okay? So any small mistake means the knife is going to fall onto the acrobat. So the acrobat told the apprentice, hey, I will take care of you, and you please take care of me. Then the apprentice told the acrobat, no. I take care of myself, and you take care of yourself. And that way it is very safer. So that is about the vaccine. We must take care of ourselves in order to take care of others. That is what little I can share with you based on the vaccine that you all have given to us on the last 1 minute summary. Anyway, other than that, I was very happy. I was very happy to follow that we have all proven actually all three speakers have proven the point that the efficacy of the Buddha's teaching still remains up to today. Dr. Ong spoke about right speech, not to spread rumors and say things that's not favorable in all those things. And Dr. Phang spoke about metta. And I would agree very much that actually speech is very much related to metta. Speech and metta, they come together. And also, of course, our Dr. Gan has spoken a lot on ethical practice, on what is good for me and what is good for you, we follow. And that is the basis of the Buddha's teaching. Do what is good for me, for yourself, and what is good for others, you accept. That is the basis of the Buddha's teaching. And I was very happy to know that it is still very effective today. And I hope that after this talk, after this sharing, we will all be profoundly affected by your sharing, and our actions and thoughts will change from today. We will look forward to the vaccine. You mustn't be afraid of the vaccine. And also Dr. Ong has also actually demonstrated, how what we call it is the reason and compassion can work together. Reason and compassion, because he has demonstrated that people of all races have come together. During the pandemic, they all have come together to help the needy. I have seen that also. I've seen that myself, that we come together regardless of all race. They have come together, and we know that somebody is in need, because the poorer people are more affected, we say. So we have done that. So it is also proven that actually reason and compassion working together. He has shown us that. And also Dr. Phang has always stressed on the law of cause and effect. These are the things that I benefit a lot, because I realize that the issues are very efficacious today. And let me see what else have I got here. And also, Dr. Gan has also said that new variants are coming in today. There's law of impermanence. Things are changing, the law of evolution. Law of impermanence, things are changing. Don't think that with this vaccine and everything comes to an end. It only comes to only the Buddha can give the medication that is perpetual. So we have to continue in this samsaric cycle unless we put our sila, samadhi, panya into practice. So I will not take much of your time. We have actually exceeded our time. I have a lot more that I've written down that I want to share with you. So the takeaway I had tonight, I think I've given you briefly. So with that, I think let us do a bit of sharing before we close. In every Buddhist event, we like to do a bit of sharing. We have a true abundance of merit tonight by spending our time sharing. The speakers shared their views, the knowledge. We benefited also, and during this time, our mind was very focused, and we have a true abundance of merit. This must be shared with all the devas, our protective devas that has protected us from this pandemic. And may they rejoice in this merits. May they continue to bless us. May they continue to protect us from this pandemic. And also we'll dedicate this to our loved ones who have passed away during this season. May these merits reach them also. And may we be blessed with company of the good and the wise always. May we always have this kind of discussion, which is very beneficial to all people, regardless of any race. So let us chant together. Ettavata chammehi sampadang punya sampadang sabbe deva sabbe satta sabbe bhuta anumodantu sabba sampati siddhya idang me nyati nang hotu sukita hontu nyatayo idang me nyati nang hotu sukita hontu nyatayo idang me nyati nang hotu sukita hontu nyatayo. Sadhu, sadhu, sadhu. May we be blessed always. Thank you so much. Thank you, Sister Mian. That was excellent moderating again. and all the panelists. Thank you very much again on behalf of TBCM. We are very grateful to you. I'm sure all viewers have benefited. Sadhu.
Sadhu,
Thank you very much.
sadhu. Sadhu to the technical team for
Yes,
taking
sadhu.
care of all our broadcasts. And of course, sadhu to all the audience. Sleep well tonight, everyone.